has now surpassed Brazil to become the second worst hit in the world by the coronavirus pandemic. The country's virus curve is showing no signs of flattening out, with infections rising by more than 90,000 a day. In a recent interview with a news channel, All India Institute of Medical Sciences (AIIMS) Director Dr. Randeep Guleria, who is also a key member of the central government's Special Task Force on COVID-19, said the number of COVID-19 cases in India will continue to rise for some more months before starting to flatten, and the pandemic is likely to spill over to 2021. We can't say that the pandemic will not spill over to 2021, but what we can say is that the curve will be flatter instead of rising very steeply. We should be able to say the pandemic is ending early next year, Guleria said. On the rising number of cases, Guleria said, the COVID-19 infection has now spread across India and has reached smaller cities and rural areas. This is why the numbers have increased. Considering the size of our population, the number of cases will rise further for some months before they flatten out. Because of our population, we will have a huge number of cases in absolute numbers, but in terms of cases per million, our figure is lower. He also said that a second wave can be seen in certain parts of the country amid resurgence of cases. On being asked when COVID-19 vaccine will be developed, he said that if everything goes well, it will be ready by the end of this year. The Delhi Metro Rail Corporation (DMRC) resumed its services on Monday over 5 months after they were suspended. The doctor held the view that as long as measures such as physical distancing, wearing masks and sanitizing one's hands were followed, the risk of catching infection will be low. On COVID reinfection cases, of AIIMS chief said, there have been cases of reinfection in some parts of the world. At this point in time, reinfection is not the major concern. There is sufficient data to suggest that antibodies once created in a COVID patient can protect the person from reinfection for at least some time, 3-6 months at least. What happens 9 to 12 months on needs to be studied. The total COVID-19 cases in India stands at 42,04,614, at including 8,82,542 active cases, 32,50,429 cured/discharged/migrate, and 71,642 deaths according to the data provided by the Ministry of Health.